Let's begin with our topic, renal and bladder cell carcinomas. And in the first section, we will talk about the epidemiology, pathology, and pathogenesis of the bladder cancer. That's the diagram that shows the different linings of the urinary bladder. So that's the bladder. Here you can see these are the two ureters that opens into the bladder and carry the urine from the kidneys to the urinary bladder. So this is the bladder. Then we have this is the urethra. Urethra is the organ that carries the urine from the urinary bladder to the outside, and then this is the prostate gland. Urethra in males have the prostate, females don't have the prostate. So the urethra is surrounded by the prostate gland, which is present here around the urethra. So this is the bladder, ureter, then we have urethra and the prostate gland, and then the urethra in the males is longer as compared to urethra in females. That's why urinary tract infection, besides some other reasons which are common or present in females, urinary tract infections are more common in females because of the small size of the urethra. This is the cancer that is present. So the section of the wall of the bladder, there is the muscle, we have the fatty tissue, then the muscle, and then this is the inner bladder lining, and this is the cancer. And once the cancer is present, depending on how invasive it is, how far it is, then we have different presentations or features present. So that's the cancer present in the urinary bladder. Epidemiology of the bladder cancer. This is the cancer cell. Then this is the urinary bladder. This is the urinary system, the whole, the kidneys. From the kidneys, the ureters carry the urine to the bladder, where the urine is stored and then it is expelled out of the bladder through the urethra. And then these are the adrenal glands present on top of the kidneys. This is the cancer cell. Cigarette smoking, epidemiology, how common it is, which are the sexes which are more prone to bladder cancer. So cigarette smoking, 50% of urothelial cancers in men and 40% in women are associated with the cigarette smoking. So cigarette smoking is one very common factor. Other implicated agents that can cause the bladder cancer or urothelial cancers are aniline dyes, drugs like phenacetin and chlornafazine, and external beam radiation. So these are some other factors that can lead to urothelial cancers. So smoking plays very big role, 50% of men and then 40% of women. Other factors is aniline dyes, some drugs like phenacetin, chlornafazine, and then external beam radiation for the treatment of different conditions can also lead to the bladder cancer. Schistosoma hematobium exposure is another risk factor for the bladder cancer. Chronic cyclophosphamide exposure is also a risk factor. So all these are different causes that can cause the bladder or urothelial cancers. We have some drugs, aniline dye, cyclophosphamide, schistosoma hematobium is also an risk factor. Pathology, or what are the different abnormality? Pathology is the subject that can teach us the study of any abnormality. So patho is abnormality, study of abnormality present. So again, this is the bladder. This is the tumor present in the bladder. We have the prostate and urethra. Staging based on the pattern of growth and depth of invasion, how deep is the penetration of the tumor. The staging depend on that, and if it's deeply invaded, the staging is for, and then the prognosis is poor. So staging and pattern of growth or depth of invasion is important in the staging of the bladder cancer and then also in the prognosis. Low grade to high grade tumors, adenocarcinomas, usually in ureteral remnant of present in the bladder dome, adenocarcinoma. Then we have paragangliomas, lymphomas, melanomas, they are rare. Low-grade papillary lesions, most common bladder carcinomas are the papillary tumors. So low-grade papillary lesions, friable bleeding tendency and high risk for recurrence for these papillary type of tumor carcinomas, and they are most common type in the bladder. So two factors plays an important role in the staging. As with any other cancer, we talked about so many different cancers, and we know that differentiation is very important. If the cells are well differentiated, the diagnosis is easy, prognosis is good if they are well differentiated. If they are poorly differentiated, the prognosis is bad. So one is the differentiation of the cells, then there is also another factor which is the invasion or spread of the carcinoma is another important factor in the prognosis of the cancer. So some of the carcinomas of the bladder, adenocarcinomas, paragangliomas, lymphomas, melanomas, which are rare. Then we have low-grade papillary lesion, and it's the most common type. Three categories we have of the bladder cancer. 75% are superficial, 20% invade the bladder muscle, and 5% are metastatic. So mostly they are superficial, then 20% they invade, and then 5% they are metastatic. Pathogenesis, field effect in urothelium, superficial and invasive lesions development, low-grade non-invasive papillary tumor, which is due to, again, pathogenesis, how these bladder cancers spread. Mutation in the genes is an important factor in the development, and we will see different mutations that can lead to the bladder carcinomas, but the beginning is usually the field effect in urothelium, and this can cause superficial and invasive type of lesions that develop. Low-grade non-invasive papillary tumors. They are due to activation of RTK RAS signal transduction, fibroblast growth factor receptor 3, phospho phosphoinositidine 3 kinase alpha subunit mutation. And then we have carcinoma in situ and invasive tumor, majority due to TP53 and RB gene alterations. And finally, alterations in P53, P21 or RB leads which have higher recurrence. So all these are different mutations that can lead to the development of the carcinoma of the bladder. We have activation of RTK, RAS signal transduction, fibroblast growth factor receptor 3, and then we have phosphoinositidine 3 kinase alpha subunit mutation, carcinoma in situ and invasive tumors. And then we have alteration in P53, P29 or RB. These tumors have higher recurrence rate, which are due to alteration in these genes. So this is the histological or microscopic appearance of the bladder carcinoma. So these are the pathogenesis, what are the different mutations that can lead to the development of the bladder cancer. More common in the about 50% associated with cigarette smoking in men, 40 in women. Some other factors also like aniline diet, drugs like phenacetin, cyclophosphamide, they are all the risk factors for the development of the bladder cancer. So that was all about the section 1. Thank you for watching sqadia.com.